Great. So I'm Jess Maurer, as you've heard, and I just wanted to echo some of the things that Speaker Eves was talking about in relation to the Maine initiative, and this idea of being at the sweet spot, or I like to say the tipping point, that really when you look at municipalities, healthcare, even development, okay? Everyone understands at this point that we need to deal with issues related to aging. And so it makes it much easier to have conversations with healthcare, for instance, when you know that healthcare is about to get paid to keep people healthy instead of getting paid to treat them when they're sick. And they're going to start to get paid for population health. And when you know that, and you know that 25% of your population is older, you know all of a sudden that they have to care about the things that you care about. The same is true for municipalities. When you ask, from the county that Carol McElwee's from, when you ask the town of Fort Fairfield why they developed a 25-unit senior housing project up there that was now coupled with healthcare, they'll tell you they did it because their people were leaving. They had all their old people were leaving because they couldn't find the kinds of housing they needed, and they saw that and they took an opportunity to develop something, and now they've got the people that are the fabric of their community continuing to live there and getting supports and services in the way they need it. The same is true for business. You heard Mark talk about our major employers are planning to lose 50% of their workforce in the next decade, and they're succession planning 3 people deep. You know, you tell that story to the Maine Chamber of Commerce and all of a sudden they care. The Maine Development Foundation cares. And so it's about finding that sweet spot with the people who are your leaders, who are not your aging allies, typically, and getting them to hear, right? We didn't go to the Chamber of Commerce. We had the conversation with employers in front of them. And the employers told the story of what they're dealing with family caregivers leaving the workforce constantly. So this is really, it's using the very people who already know the problem to tell the story to the other leaders, and that's how you really get everyone involved. So with that, I have the privilege of introducing our very first panel, and this is how we started our process in Maine, which was talking about the economic impact of our aging demographic, not just the challenges, but really underscoring the opportunities that exist in relation to those challenges. And I always say, you know, old people are not the problem. In fact, they're the solution. The problem is that we didn't plan. Even though we knew it was coming, we didn't plan. And so now we're here, and we have to do something about it, and we are. So I get to introduce you to 3 folks. Ken Jones, who is going to speak first, who is from Vermont. And by the way, you have their bios, so I'm not going to read you their bios, but I will tell you that he's trained as a biochemist and worked for many years in utilities public policy. So it's understandable when he says he's not your average state economist. He's an economic research analyst for the Vermont Agency on Commerce and Community Development. So thanks, Ken. I'm going to introduce all 3 of you, and then we can move to your presentations. Next to him is Charlie Colgan, who's a professor of public policy and management at the Muskie School of Public Service in the University of Southern Maine. And he is also the director of the USM Center for Business and Economic Research and a senior fellow at the Center for the Blue Economy in Monterey, California, which I think it's no longer a surprise that Charlie is actually retiring from the University of Maine and heading off to California fairly quickly. So we're very, very sad to lose him as an incredible resource, and he really has been on this issue in particular. And then finally, Steve Norton is the executive director of the New Hampshire Center for Public Policy Studies, which is a private, nonprofit, nonpartisan think tank whose mission is to enhance and enrich the policy conversations on issues of critical importance to New Hampshire's future, and in particular, the housing study they have done here in New Hampshire has been really helpful and instrumental in helping us think in Maine through many of the housing challenges that we are facing as well as New Hampshire. So I'm going to turn things over to Ken.
you, Jess. So do I know how this thing works?
Oh, here, you need that.
I do need this. So I am Ken Jones, and first of all, I have to seek your understanding of my weaknesses. I am a white male born in 1957. The fact that I'm a male, there are more males, there are always more boys born than girls, and that's an accident of biology. I can't do anything about that. I'm white because my parents are white. Can't do anything about that. But I do want to put an emphasis on 1957. There were more children born in 1957 than any other year in the 20th century. I am your vanilla poster child for the baby boom. And as going through the public, and I was born in Amherst, New Hampshire. And growing up in Amherst, I was the subject of derision because they had to build schools for me, and my friends. And as I progressed through every stage of my development, I was the one, our group was the one that had to be the force for the world changing around us. And now I get to the point where we're retiring, and we're going to become senior citizens, and so it's a reason why I'm glad to be here, because I hope that you folks can help fix all the problems that my generation has created. So the first thing I want to show here is that I'm from Vermont, and the nice thing numerically about Vermont is we are about half the size of New Hampshire and Maine, so that when we look at Vermont, New Hampshire, and Maine next to each other, we can always just take the New Hampshire and put them on New Hampshire and Maine on one side and just cut Vermont or double the size of Vermont and line everything up. And you can see that population change in three northern New England states is some great similarities. New Hampshire and Vermont had a little bit more growth in the 90s, but through the 2000s, the three states have grown at about the same rate. And the reason we're here, this 65 plus population change increased, again, in very similar patterns across the three states. One of the factors that not only is the baby boom aging, but another factor, and this is very pleasant news for me, is that great benefits in public health and the health system. The mortality rates continue to drop very significantly. There aren't many things that surprise me in the world. This has been one of them. I took on the challenge of doing the demographic analysis for the state a couple years ago. And finding that the mortality rates for folks 65 plus, 75 plus has been cut in half in the last 25 years, I find absolutely fantastic. Not just because I get to reap those benefits, but the fact that it is a real sign of progress, and let's never forget the progress that we have. But it does lead to this additional problem. Baby boom shows up, and we've forgotten how to die. Okay? So it's another reason why we need to keep our attention. And if a message for you, nothing I'm going to say here is news for you folks, but it is such an important message to get out there that baby boom always surprises planners, always surprises public policy makers. We have to promote this message so significantly that not only is the baby boom going to reach its retirement and end of life time, but it is going to be even bigger than it has been in the past because of these mortality rates. So you can see the other piece of the population change is migration, and the migration rate this is now from now on all Vermont, okay, but I'm sure this is very similar for New Hampshire and Maine. Vermont has had 20 years of positive net migration of maturing adults, not seniors. It's very hard to track senior migration for somebody like me. But that maturing adult, we pumped people in. So it's just another factor that leads to this piece, okay? If we look at 65 plus, sure, we've seen growth. It's going to grow much faster. Now, we need to change, people like me need to change our vision of aging a little bit. 65 plus is certainly a story. It's the traditional retirement piece. But in terms of services, it really is the 75 plus. And we've got a little bit more time there, okay? 65 plus is happening now. It is baby boom started in 1946. Those folks are retiring. Those folks have hit 65. And that number is going to explode in ways we've never seen. 75 plus, we've got a little bit more time. One of the piece I'm going to focus on for my little blurb here is the housing piece. In addition to population change, what we know happens is the number of households. It's actually you house households, you don't house individuals. The number of households in Vermont has seen a steady increase, and this is just going through to the present, not going into the future. And in Vermont, the top line there is actually the number of housing units, and the bottom line is the number of households. Looks great. We have more houses than we have households, but we've got a little problem. Vermont has a lot of second homes, so that if you actually match the non-second home, non-vacation home to the population, it's very close. Vermont, tomorrow's meeting is a housing meeting in Vermont. No question, Vermont has a very, very tight housing market. And so putting these stories together, while the population is going to plateau, because this little graph on the, whatever that is, that side, I'm a little dyslexic, on that side shows that household size also drives the number of households, and it's going to continue to decrease again because of us baby boomers. As we get older, we tend towards a very constant household size. In Vermont, it's 1.55. Ages 65 and over are in households that are 1.55. Household size now is about 2.3. As we become a greater part of the population, more and more of these 1.55 households are going to be established. So while the population is going to plateau, the number of households is going to continue to increase. Therefore, the pressure on housing is going to increase. And then to project forward, taking that 65 plus population and translating it into households, you can see, again, population for the state plateaus, number of households that have one or more individuals greater than 65 is going to continue to increase. All of this happening while housing construction in Vermont, I imagine across the northern New England states, has plummeted since the Great Recession, was a source of the Great Recession. So again, my little piece of the story here is this housing piece, not just housing focused on seniors, we'll talk about that in a second, but housing in general. There is going to be a greater pressure of the need for housing units, and driven by, once again, us. In Vermont, the older households are in the more rural parts. For those who know Vermont, there's our Chittenden County, the blonde part of our blonde state. And it's blonde in this case because it has the lowest proportion of older citizens. And as you move further from Burlington and the Champlain Valley, you get in more rural, you also get higher density of older population. And unfortunately, that is also where the money isn't. The greater concentration of wealth in Vermont, again, is around Burlington, Chittenden County. You move further from there, and the very blondest county in this slide is Essex County, our most rural county, the northeastern part of our northeastern kingdom. So where the elders are is not where the money is. Again, that's going to be a challenge. So I'm not here to talk about policy specifics, but just to lay out the three categories of policy options. This is going to be a very, very significant policy issue, therefore deserves, message one, a diverse set of solutions. Certainly the first is aging in place. Just as a practical matter, because we have such a large number of older folks that are going to be living in their homes, moving them is going to be a big challenge. Developing the systems to allow folks to age in place is a big starting point. Second, to help meet, in Vermont in particular, these are the very important goals to us, to meet smart growth goals, energy efficiency goals, and the ability to provide senior services. The use of our existing downtowns and villages, those structures that are underutilized at this point, to use those for senior housing, that's part two of the policy possibilities. And the third part, again, are we going to see a recovery from the housing construction? Population plateau, okay, so there's not that that increase in population, increase in workforce. It's not a slide I have here. Vermont is facing something it's never faced before. From this point on, we are going to have fewer people in the 20 to 64 age group. It's never before happened in our history, common across the northern tier states. We're having fewer workers, therefore developing the resources necessary to get this construction. It's going to be a challenge, but again, it's the third piece, the third leg of this stool in terms of addressing the housing needs. And as we look at those three pieces, let's not forget the market. I am a little bit of an economist, okay? And so my part of being an economist is always look to the market first. So to the extent that we can gauge where senior households are looking for their future housing needs, they're looking to age in place, they're looking to move into the concentrated communities where the services are, where they don't have as much transportation needs. And to the extent that they're looking for new housing opportunities, whether it be assisted living or other senior communities, we really need to keep our eye on that because it's so much easier to work with the market than to work against the market. And that's what I have, and I don't know if we want to do questions at the end. Okay, so that's the little bit of story from Vermont, and thank you for listening.
So thank you and good morning. All of us who talk about this issue talk about how different it's going to be, and Ken was just talking about how, this conference is dedicated to the idea that it is going to be different, but that it's going to be different for a lot of different places, for Maine, New Hampshire, and Vermont, and we kind of focus on that. The truth is that a society as dominated by old people as we are currently emerging into has never existed, period, on the planet, ever. There has never been a society of humans on this planet that is as old and has as many old people as today, simply because life expectancies have lengthened. Nutrition and economic wealth has created a possibility for people to live longer. People are not working in the factories and the farms and the fields, and that has helped people live longer. So whether you are in Maine, New Hampshire, or Vermont, or Hokkaido in Japan, or in Italy, or in Germany, the two oldest countries in the world are Germany and Japan. Largely because, of course, much of their younger population was wiped out in World War II. Nobody's been here before. And we're all kind of feeling our way in the dark through it. So while those of us who are in the forecasting business and thus are condemned to eat glass, can, to some extent, foresee some of the dimensions of what we're talking about. The truth is that most of what's going to happen is not seeable in today's terms, and will have to emerge as we go along. So all we can do is kind of outline some of the framework. I want to emphasize two things. The tendency here is to talk about the emergence of the older population, 65 plus and 75 plus, but I want to emphasize that you cannot see the society's problems in northern New England or anywhere else without seeing the combination of issues with respect to both young people and old people. It is the age imbalance. It is the fact that we have a huge imbalance in our age structure that is at the root of the issues that we're going to have to deal with. If you look at this slide, this is Maine, and I'll focus on Maine for the most part, but frankly, I could do the same, we all could do essentially the same graph for each of our states. If you look here, there is a very long echo to the baby boom. Ken talked about his position at towards the end of the baby boom. I'm kind of at the beginning of it. But we're all going to live with the long echo of that boom. The leading edge of the baby boom turned 65 in 2011. It will turn 80 in 2026, just in time for the trailing edge of the baby boom to turn 65 in 2031. The trailing edge of the baby boom will turn 80 in 2044. Okay, so we're looking at 30 to 40 more years of the baby boom essentially being a major part of the population. And this is particularly the case because if you look at the 65 plus line, that's the people on the red line. Now look at the 20 to 34s. The 20 to 34s are your entering labor force. And what you see here is the lack of babies that were born in the states of Maine, New Hampshire, and Vermont, or Maine here in particular. New Hampshire is a little better because a lot of people moved in from Massachusetts. But basically, a significant decline in the number of younger generation people who were born in the 1980s and born in the 2000s. Basically, the imbalance in the age structure is brought upon not by the story of the younger people all leaving the state. In fact, in Maine, the large number of people who leave rural Maine come to urban Maine. The largest number of people who leave Maine are leaving from urban Maine to urban places in the rest of the country. So it's not true that rural depopulation, at least in Maine, is headed for Pennsylvania or New York. They're headed for Portland and Bangor. But the people in Portland and Bangor are leaving. But that's not the story. The story is we have not had enough children born to replace anywhere near the number of people in the baby boom, nor have in Maine we attracted nearly enough young people to move to Maine. The only decade in the 20th century in which more young people moved to Maine than moved away from Maine was the 1970s, which was the peak of the generation of the baby boom as they entered their 20s and 30s. That's when I arrived for permanent residence. It became something other than a summer complaint. Been there ever since. Will still be there. I'll be moving to California part-time, but I'll be back in Maine for the summers. Be back to being a summer complaint, you see how it goes. You can see the age imbalance in 2010 already beginning to form. 25% of Maine was under 21 versus 28% in the US. In 2030, 21% of Maine will be under 21 and 26% in the US. In contrast, 36% of Maine in 2010 was between 41 and 64 in the older working years, and this is the group that will be gradually moving into the retirement years, though at a very uncertain rate. It's wrong, incidentally, to say that 65 is the retirement year. For almost all the baby boom generation, you will not be eligible for full Social Security until 66 or later. So 65 is not the break year that it used to be, and in any event, most of us will be working longer than the first year of eligibility for full Social Security. But how much longer? Ken points to the 75 and older group. That's where I think you're going to see the real break in the mid-70s between the older people staying in the workforce and leaving the workforce. Maine in 2030 will be 26% over 65 versus 19% in the US. And if we carry that out a little bit further, the Maine age district, I think I want to skip past this one. Just for comparison's sake, here are the median ages of southern, northern, and northern New England. Maine, and this is in 2013 American Community Survey data. Maine's median age was 44, New Hampshire 42.3, Vermont 42.5. Southern New England, Connecticut 40.5, Massachusetts 39.4, Rhode Island 39.9, the US 36.8. So you can see the difference here between New England and the rest of the country and between northern New England and southern New England. In rough terms, the median ages of Maine, New Hampshire, and Vermont, were we independent countries, would place us in the top 10% of the oldest countries in the world. Here's the New England age distribution. in 2013, Maine at about 16% over 65, New Hampshire a little bit about the same, and Vermont. The big differences are down there in the younger populations. Maine, again, less than 20%, under 21, New Hampshire about 21%, and Vermont about the same. Maine is the oldest state in the nation, not because we are wildly disproportionately old, but because we are wildly not disproportionately young, and that makes a big difference. In the next 20 years, out to 2030, this is based on forecasts that I've done. This is the regions of Maine relative to the state of Maine. And basically anything above the line 1 is more concentrated in that age group than the state. Anything below the horizontal line, the red line, is less than concentrated than the state. Aroostook County will remain the oldest state the oldest county in Maine, but ironically, Maine's going to catch up to Aroostook County. So it will relative to the state, Maine is going to look a lot more like Aroostook County in 20 years, and Aroostook and Maine will be essentially the same, where today Aroostook is much older. Cumberland will remain much younger than the rest of the state. York County will become a little bit younger, but eastern Maine, western Maine, and the Midcoast in particular, the Midcoast will become our oldest region relative to the state because of the demographics of that area. Midcoast is Waldo, Knox, Hancock, Waldo, Knox, Lincoln, and Saginaw. In Maine, the older population is concentrated in 2 areas: the rural rim, the northern rim, and the coast. This map shows the specialization of population, with red more populated by 65 and older in 2010, in 2000 on the left, and 2010 on the right. So the reds are more specialized in 65 and older, the blues less specialized. You can see Aroostook County, eastern Maine, and then you see the interior rim of the older population and the coastal concentration of older people, particularly there in the Midcoast, in Hancock County, and to a large extent in York County. Those are the 3 major retirement centers in Maine. Since 2008, Maine's population has grown by a total of 600 people. That's a small subdivision in Las Vegas. And all of Maine today, and I think this is true of New Hampshire and Vermont, but I haven't looked at the numbers there. All of Maine today is in natural population decrease, which means that all population growth for the foreseeable future must come from in-migrants. The blue line in this graphic shows an estimate of the number of in-migrants that are needed for Maine to keep up with national economic growth over the next 30 years. The model that I use says we have to bring in about 8,000 people a year to keep up with national economic growth. If our in-migration is the same as it has been for the last several years, the green line shows our employment over the next 30 years. Essentially, we lose about 20,000 jobs. And migration and employment have not been going together very well. They go together, they're very cyclical. And only in one period in the early 2000s did we see more migration than the economy would allow. I'll skip past that one. One of the big increases here is that labor will cost more. Maine is used to paying below average, national average wages. We are not going to be able to do that anymore. And the reason we're not going to be able to do that anymore is because there aren't going to be enough people to attract. In order for us to attract labor and keep labor, we're going to have to pay a lot more. The retirement age is increasing, and people are expected to work longer. But we're only going to get about 10 years or so out of this effect before in the mid-2020s, the baby boom generation begins to hit the mid-70s and retires at a much faster rate than they're going to do over the next several years. A big issue here is the looming, what I call the looming governance crisis. A lot of small towns in Maine are almost completely dominated by older people today. It means a lot of people with time on their hands to go to town meeting. On the other hand, there aren't going to be enough people left in a lot of towns to essentially run town government. Population decline is already a fact of life from 2010 for 158 of Maine's 500 towns. The red line, all the boxes in red here are towns that have declined in population in the last 10 years, to say nothing of the next 20. And the crisis will hit first in schools, where our 287 school districts colliding with our declining school population is going to create a significant crisis in education in the not distant future. Oops. One of my slides didn't get in here. The opportunities that are created by this change in society are very important. We know that there will be enormous changes in healthcare. We know that information and communications technology, ICT, are going to lie at the heart of many of the economic opportunities, the development of new ICT technologies, the development and deployment and training of people to use information and communication technologies. Apple's recent announcement in the iPhone 6, this is a 5, that it will devote a significant portion of their products to health maintenance and monitoring, represents the leading edge of what will be the next generation of deployment of ICT for health-related purposes. Google is talking about self-driving cars in a world in which the vast majority of people get around by driving. Whether it's a completely self-driving car like Google's or a driving assisted vehicle, such as we already have with backup parking lights, parking warning, and so on. Transportation and the deployment of information communication technologies in an aging society represent for all three northern New England states huge opportunities to develop new businesses, new ideas, and new technologies that can, if successful, be a significant source of economic growth for all three states, assuming we can keep people in the workforce longer and can attract enough workers to stay here or come here to make it happen. So it's not all about the problems that will be created by the aging society. It's partly about that one got in the wrong place. It's partly about how we actively reshape our societies. A lot of that's going to be in healthcare, a lot of it's going to be in social services, but a lot of it had better be in things like transportation and technology innovation if we're going to have any kind of economic growth opportunities that will be more than just simply taking care of a declining population. I hope we do better than that. Thanks.
I'll just say while Steve's getting all set that in January I heard this same presentation from Charlie, and it was only 7,000. So we have to do something quick. The numbers are growing. No questions yet.
Oh, darn. It sounded like you had a good one.
Yeah, good try.
So I have the great advantage now of completely throwing away my slides. Okay? To some extent, Maine, New Hampshire, and Vermont are very similar, but in many ways they're different, and they're different because of something called I-93. All right, so if I look back in the history, in 1968, New Hampshire was 740,000 people. Okay, and at that time, just to give you a sense of what they were worrying about, put my glasses back on now, thank you. This is a new thing for me, so forgive me. The state as a whole is characterized by a net outmigration of citizens in the age bracket 15 to 29, and the in-migration of citizens or growth in citizens over 75. A similar demographic trend observed today. The report continues to forecast population loss in Carroll and Grafton counties, through the year 2000, which didn't happen, and substantial gains in service occupations in New Hampshire, including jobs in finance. What that report did not predict was that New Hampshire would see a 68% increase in its population over the next 30 years. It's the single largest increase in the country for a state. Population almost doubled, all right? And that was all a result of outmigration from Massachusetts, right? When I think of the one picture that describes actually the history of all of us as a state, as states, it really was about migration, and it really was about the baby boomers. I am not a baby boomer, but I reflect the same pattern. I was a kid who grew up here. My grandmother owned a farm here in 1937. I left, never to come back, I promised. But I came back at age 30. And this is really the trend that you see. And I put up this regional map because I think it makes sense for us to think about the challenges and the opportunities of thinking of ourselves as a region. When I was the state Medicaid director in New Hampshire, we were trying to figure out how to get the 3 governors together to make some joint decision making around prescription drug services. Didn't go very well. And it didn't go very well because we didn't really understand the opportunities and challenges of that, not because it wasn't a great opportunity. So basically all this northern New England stuff is about the folks moving out of Boston into southern New Hampshire and to a certain extent southern Maine. And you can see this, the map shows anything that's in red is population loss, pretty considerable in some instances. Anything that's blue is in-migration or growth in the population. Anything in yellow represents a decline in population. And if you look at 1980 to 1990, you see mostly growth in southern New Hampshire and a little bit in southern Maine, and then you see again in 1990 to 2000. But this is the problem going forward. They've all talked about it. And this is basically where I'm going to start winging it. Population projections in New Hampshire are pretty grim. All right? And the problem with this is not that they're grim. I think you could manage that as a group, but the problem is the transaction costs now that we're all experiencing. We're having a hard time separating our experience from what the last 30 years were. And I'll just give you one classic example. I sit on the Concord Zoning Board, which is our state capital, and I cannot get my fellow city council members to approve multiple occupant housing. And so we got this guy, his name's John Chorlian. He's a great developer. He cares deeply about the community. And he says, I cannot build out these places with just 2. I need to build them out with 3. And so we're going to have this issue where all our communities out there want to maintain their integrity and what they look like. And the fact is, they're not going to look like that. And you can either control that or not, right? So big challenge. This changes all our policies across the thing. I'm going to start winging it. New Hampshire is slightly different than Maine, of course, because we only have, 18 miles of coastline, whereas there's a whole lot of coastline. And Vermont has, that place up on the lake. Can't ever remember, Burlington. We've got our economic growth line up I-93 and also to a certain extent up I-95. And that's really been the nature of our state's development. This shows median age. The darker the burgundy, the higher the median age. Anything that is the darkest burgundy is over 50, okay? And for those of you who don't know New Hampshire, where it starts to get really red is called the notch. And that is what differentiates northern New Hampshire from southern New Hampshire, really. And southern New Hampshire is obviously down in the eastern and southern part of the state. And really, we've got 3 states. We've got above the notch. Whoops, did I just hit something? It's telling me I gotta move. Above the notch, we've got rural, which is towards the west, and then we've got this more the younger, if you can call it younger, communities down south. And what that means is that the policy solutions that we're all gonna have to look at are gonna be very different. You also cannot take for granted that what you think is true any longer. And I'll just give you an example. In northern New Hampshire, when looking at the age, you see a very high median age. You also see a high percentage of the population over the age of 65. And you would think, therefore, that that is going to be your most vulnerable communities. But in our cases, it's probably not. And the reason why it's not is something called the mills and pensions, okay? We have less elderly poverty to some extent above the notch than we will in southern parts of the state where we have incredible economic wealth in the form of second homes because we have this bifurcated distribution of income among the elderly. So thinking about solutions in New Hampshire at least, and I suspect it's true in other areas, geographically they're going to be very, very different. The workforce issue is again a geographic one, and We're going to experience, if all things go as they seem to be going right now, unless we see some big change, we are going to see in some communities a 25% reduction in the working age population. Now, those communities will die if they have that experience. So I don't think that's going to happen. And the great thing about not being an economist and not being a biochemist is that I don't actually believe what I say in predicting the future. Because really all this is if nothing else changes. And if we learned anything from looking at 1968 in New Hampshire, no one predicted that we would have this incredible thing happen. And so there's optimism there in my mind. The housing demand mismatch in New Hampshire is actually probably one of the biggest problems that we face in terms of recruiting people, because we did some housing work which showed that the millennials, which is where we're all looking to bring some folks into the state, and those that want to age in place but don't want to age in place in a 5-bedroom house are now starting to compete for the same homes. And so not only do we have this dynamic that we just simply don't have enough 2-bedroom houses or 3-bedroom houses, we now have this direct competition between the people we want to recruit and the folks that want to live in place in their communities that are trying to downsize out of these really catastrophic homes. So, I mean, catastrophic homes, large homes. I have a catastrophic home. Built in the 1850s. The idea of having to maintain a house, even in my 50s, is really troublesome to me. So the question then is, what are the leverage points? I think it's actually in New Hampshire, local communities. Most of our activities are based, and our zoning and housing and land use policies are based at the community level. And they're not struggling with these issues yet. They're struggling with something which I'll show you in just a minute. Yeah, I'll skip over to that. And that is this looming municipal crisis. And it's a different one. I hadn't heard Charlie speak before, but I think he's exactly right. We're not going to have enough people to actually run local government, but we're also not going to have enough kids to have schools anymore. And so it's going to precipitate, I think, a profound rethinking of what communities are going to look like, and consolidation, and communities that need to come together. And it may actually be a huge opportunity to rethink the concept of land use in our communities. We're simply not going to be able to support the level of town government in New Hampshire, I don't think, that we've been done in the past. And at the same time, I don't know how many people here are healthcare, but we've also done quite a bit of work simulating the potential impacts on the long-term care system in New Hampshire. And I'm going to show you these projections. And it drives the home care community people crazy and the long-term and the nursing home people crazy. But if you take the ratio at which we currently use our services right now, and you just age the underlying base, and you multiply the number of people that are going to be in a certain age bracket times their current use of services, New Hampshire needs another 4,000 nursing home beds just to meet the basic demand. Now, is that going to happen? No, they were predicting the same thing 30 years ago. What happened was nursing homes reduced their lengths of stay from 3 years to 18 months. So what that tells me is that we're going into another period of pretty amazing transition in the long-term care system, whether it's rethinking the very concept of communities, which I think is ultimately probably the best opportunity, or building new facilities. That's another thing entirely. But I think the real question that we all have to face is one that, I can't remember, I think you said it, Jess, and that is, what does an age-friendly community look like across every single leverage point that we have? So if I look at what New Hampshire has in terms of its acute medical services, we've got docs offices, we've got docs in the box, we've got hospitals, we've got acute care facilities. We move to chronic medical conditions, you get into community-based long-term care, the supports that exist there. You get into assisted living or mid-level care, residential services, and then you get into these nursing home services. You've got 7,000 people that are receiving financial grants from the state in the form of food or fuel. None of those things are coordinated in any fashion. All right? And so in the healthcare world, I think we're going to have to start having the same conversations we're having in the acute care world, and that is, what does a long-term care, accountable care organization look like? What set of organizations are going to combine so that we're caring for a population in a given area as opposed to individual services in a silo? The second thing is that we're going to have to think differently about how municipal and state services are interacting. A lot of the state expenditures, either in the form of tax expenditures or actual direct expenditures, are about housing. And so how can these two systems that distribute financial resources to communities think differently than they currently do. And then the final one, I think, if we all had our druthers for an aging population, we would build out something like a Kendall in every community. I think that's the dream, where you have an individual who gets to stay in their community, they get to age through the various circumstances that they want, they get to increase their participation in the workforce because they don't have to worry about their housing and other things, they don't have to retire. That's the most beautiful world. Unfortunately, it's also the most expensive world. And so how do communities actually start thinking about what the set of resources they have differently than they currently do? And we have a couple of examples of that in New Hampshire, and I'll stop with this so that we can have more time for questions. John Hoffman, who is here, a spirited leader in New Hampshire in one community, has really galvanized the community to think differently about what it wants to do with its old county nursing facility. And that's one way in which New Hampshire, I think, is different than both Vermont and Maine. Our long-term care system is largely driven by, or a public long-term care system is largely driven by community. And I've watched John work with all the politics of county government and workforce and expenditures and the like, and it's going to take that kind of leadership in every community. And so one part of me, and Lori Harding, whoever here, Representative Harding, and I have talked a great deal about this in New Hampshire, probably the single most important thing you can do is create leadership at the community level about how the community wants to grow itself and age, because anything that's applied from top down is not likely to work very effectively. So I will stop there.
Thank you very much. So now we're going to open it up to questions, and Julie has the first one, and then Rick. Who's got the mic? Oh, there we go.
Recently in Maine, Jim Tierney spoke on Maine Public Radio, and I don't know if others heard it, but it was a very fascinating talk. I think it was at Bates College, about the need, when we talk about aging, to talk about immigration and race. And he was making the argument that we can't talk about aging without talking about immigration and race. And the fact that if the pool of people, younger people, that we may be wanting to recruit are from diverse communities, and we're looking at these hugely super white states, that we really need to rethink what it means and how to potentially create diverse communities that are welcoming and supportive of people both of race and other cultures. So I know I've heard Charlie speak in the past about, we couldn't recruit or immigrate enough people to replace the younger people, but I thought it was a very interesting talk about beginning to expand what we're thinking about here beyond, aging, but also add the discussion related to diversity and race and immigration. So I wondered if any of you folks had given that some thought and had any comments on that.
We in New Hampshire absolutely have that conversation, or at least we try to bring that forward as an organization. When you look at nationally, the only source of real growth for those under the age of 20 right now are Latinos or African Americans. So, if you're really interested in recruiting folks, that's one reason. The second reason is the millennials are still more white than not. They don't want a non-diverse community. They want a place. So even if you're not trying to court a diverse population workforce, the millennials want that. So one of the big questions that we have as a state, our main corridor, Manchester is our most diverse, followed by Nashua. How do we build that out as a real resource for the state from a workforce development perspective?
So first, the good news about Maine. We increased our non-white population by 50%. From 2000 to 2010, we went from 2% to 3%. More importantly, every county in Maine increased its population of both Hispanic and non-whites. So the numbers are kind of small, but then so are some of our counties. But it is a phenomenon that is beginning to occur, and Julie's point about establishing a welcoming and favorable environment for that is, I think, important. I think it's also important to point out that the national debate we are having about international immigration and almost all of the growth in Maine's population over the last 7 years has been from international migration, not domestic migration, which we're still losing people. It's been international migration. And so the national debate about immigration is a very important thing for northern New England. The current debate essentially would shut off America from international migration and virtually shut off the major source of supply for northern tier states in northern New England. So while the debate is mostly about what's happening on our southern border and to some extent our Canadians border, the truth is this is a major issue for us as well as the rest of the country.
I will also say, and can we bring the mic down here to Rick, that one of the pieces of legislation that's not going to cost money that we're talking about this legislative session is actually some credentialing legislation to help people who are coming to our state, whether they're coming from another country or from another state, to be able to work up to their license as quickly as possible.
I want to thank Steve for bringing up almost an answer to my question, which is we have so many little towns in the northern tier states. What are we going to do about it? I mean, you called it a problem. I'm going to say, hey, we got a problem. Is there anybody here that can talk, you guys there, and anybody else who can talk to, how are we ever going to do that?
My father is a geologist at the University of Maine, and he likens our understanding of demographics to his ability to understand glaciation. It takes a long time for societies to adjust, and we've actually been through one of these cycles already. The depopulation and repopulation of urban areas. And so it's going to happen. It's just going to take a long time. And one of the questions that we're beginning to struggle with is how do you help those communities do that in as graceful a fashion? Because it's pretty hard to stop once it's started. And I don't have an answer, unfortunately.
And you said some of these communities are going to disappear, I think, but they need to merge. I mean, you're not, stuff, the physical, the plants and everything's still going to be there, but they can't be a little town here and a little town here and two more little towns right next to it.
Ken, did you have something?
Yeah, in Vermont, full disclosure, I'm on the school board in Montpelier. Last year, the legislature considered, and I think will consider again this year, Vermont has the most number of school boards of any state in the union. And wants to do a consolidation, and you know the response. It's local control, folks, and it's going to be the same with municipal government. Schools handle a lot more money than the municipal government. So in Vermont, the battleground is going to be the schools.
One more question, Wendy.
Oh, I can shout. Don't worry about it.
No, come on.
Hi, Wendy Wolf of the Maine Health Access Foundation, and actually a local select person of the oldest county in the oldest state in the nation. And I'm just curious because what you're bringing up is very relevant to what I'm trying to occultly push, which is having our towns in our region think about merging and collaborating, which of course is an anathema conversation. But I'm just wondering if people in the room or you folks have seen the engagement of municipal government or say Maine Municipal Association, or I don't know what exists in Vermont or New Hampshire, as part of this discussion, because I get my municipal official magazine and this is not on the radar screen, or at least publicly mentioned. So it may be that we are missing a key constituent in these conversations that are going to help us think about efficiencies, mergers, and designing communities in ways that are sustainable. So if you could comment.
So I gave the presentation I gave you this afternoon to the Maine Municipal Association last month. It didn't go well. Here's what I think is going to happen. I think that we are going to be in denial on this issue. That the initial response to the decline at the local level in both schools and in municipal governments will be to demand increasing state subsidies to keep the local schools open and to keep the municipal governments solvent when their tax base is disappearing. This is going to go on for about 10 years, and then we're all going to run out of money. We're all going to run out of money because our economy is not going to be growing fast enough to produce enough surplus wealth to supply that level of subsidies. And so sometime in the mid-2020s, after wasting 10 years, we will finally get serious about the consolidation and the changes that are going to be needed at the local level to accommodate a very different society. But I think we're going to have to go through a period of denial and fighting it and demanding that the existing system be preserved before we can get there.
Oh, go ahead, sorry,
Just
Steve.
one little bit. In New Hampshire, our municipal association actually requisitioned a study on regionalism, recognizing that they have some struggles coming forward. And I'd also just note that the healthcare industry is actually starting to set the tone for consolidation and collaboration, which is having impacts across communities. So in our three most northern hospitals, they have moved from collaboration to now governance convergence, and the towns are now starting to see the advantages of those types of things. So I think Charlie's ultimately right. There's going to be this group that is struggling right now, and things are going to fall apart relatively rapidly, and they're going to have to do something. There's that people in the middle that'll ignore it for 20 years until we run out of money. But at least in New Hampshire, they seem to be having those conversations now.
One of our high-end retirement developers said, 20% of the people that come to look at their units are planners, and the other 80% have just been hit by a 2x4. And I kind of think that that's what's going to happen with towns, is that there are going to be towns that are forward-thinking, that are really collaborative, and we have to find them. We have to invest in what they're doing. We have to help them do it, and then we have to tell the story about it. So that's my goal. I think we're out of time, actually, and these folks will be here to talk with folks. And so we're going to take a break now, and we're going to come back at 11:15. And at that time, you're going to hear from Jen Peterson, who is the Vice President for Community Grant Making at the Vermont Community Foundation, and she will introduce you to the next panel. So thank you very much.